This module is on patient identification and colored wristbands. The educational objectives on completion of this module are: the learner will confirm the 8 rights of patient identification with every patient encounter, utilize the 8 critical elements of patient identification, state the procedure for patient identification for an actively participating patient, articulate the patient identification procedure for patients unable to participate. The learner will also identify when patient identification is needed, identify when two-person identification is needed, identify infant, newborn patient identification process, and identify the process for a missing ID band. The 8 critical elements of patient identification are: using 2 patient identifiers that includes the full name and date of birth. The medical record number is to be used when a third identifier is required, for example, during blood transfusions. For outpatients not requiring an ID band, patient's home address can be used. In skilled nursing facilities, a picture ID may be used as a third identifier once full name and date of birth have been confirmed. Include active patient participation. The patient will be asked to both state and spell their first name and date of birth at all points of registration process, during first encounter with the patient, and at placement or replacement of the ID band. Compare patient statement to ID band and source document, or if you're using barcode technology, compare it to the barcode technology. If patient is unable to participate, for example, in cases of altered mental status, pediatric population, ask the patient's family to state patient's full name and date of birth, and compare the ID band to the source document such as EMR or medical administration record, provider order, or requisition. Complete a simultaneous but independent 2 staff member patient ID when required, such as for blood administration or chemotherapy. Label all specimens immediately after obtaining and in the presence of the patient. Do not use location or description of the patient as an identifier. For example, room number, door, test, or diagnosis. Do not proceed if the ID band is missing, incorrect, not legible, or if the patient has a question or concern. Clarify and escalate as needed. 8 patient rights of patient identification are: for every encounter, it is expected that every patient rights are confirmed to ensure safety for patient and staff. The rights are: right patient, right test, treatment, procedure, medication, right time, right location, right reason, right to participate, right to understand, right to consent or refuse. For inpatient, outpatient, and emergency department ID band application, please refer to the algorithm provided in the slide. Source documents are any healthcare records containing information which are actively used during patient care and treatments, such as electronic medical record, medication administration record, provider order or requisition, and food service order. Family is anyone the patient designates and may include spouse, parent, guardian, significant other, patient representative, or a patient support person. All inpatients, emergency department patients, ambulatory outpatients who are scheduled to receive sedation analgesia requires to have an ID band. Patient identification requires to be done for all inpatient and outpatient registration prior to patient exam, test, specimen collection and processing, prior to any treatments or procedures, medication administration, dispensement of breast milk. Patient identification will also be required for medical record documentation, admission, discharge to or from unit, while transporting the patients, all handoffs and transfers, reporting test results, for handoff communication and correspondence with or regarding patient. At all points of the patient registration process, the patient or the patient's family will be asked to state and spell the patient's full name and date of birth. After the ID band is placed, the staff will visualize the ID band and physically show the ID band to the patient and family for visual and verbal confirmation of accuracy. Place the ID band on extremity that is not involved with treatment. Educate patient and family members on the purpose of the ID band. Patient encounter with active participation. For identifying patient at the first encounter in all treatment or service location, ask the patient to both state and spell their full name and date of birth. On subsequent encounters, ask the patient to state full name and date of birth. Compare patient statement to the ID and source document or barcode technology if available. If patient is unable to participate in patient identification process, ask patient's family to state and spell patient's full name and date of birth. Compare family statement to the ID band and source document. If the family is not available, identify patient using two identifiers, which is the full name and date of birth. Medical record number can be used as a third option. Compare it to the ID band and the source document. If you are in doubt, always escalate. Always label all specimens in the presence of the patient. Do not proceed if ID band is missing or incorrect. Always notify the RN. In situations where the patient's ID band is missing or unreadable, do not proceed. Clarify and escalate. Notify the RN. If the patient is able to participate, an RN, NP, PA, or MD replaces band using identification process. If the patient is unable to participate, two staff members, one must be an RN, NP, PA, or MD, will re-identify the patient and replace the band. Newborn and infant identification will include three identifiers: full name, date of birth, medical record number. 4 ID bands will be utilized. 2 will be placed on the baby, 1 will be placed on mother, and second on the person of mother's choice. Please check ID policy for additional provisions of newborn patient identification. For any blood product or chemo administration, It is required that two licensed healthcare providers each will independently identify the patient. Each of the two nurses independently compares the patient's name, date of birth, and medical record number from the ID band on the patient to the name, date of birth, and medical record number on the transfusion administration record. The identification has to be done at the patient's bedside, and both licensed healthcare provider has to stay at the bedside until the transfusion is started. Educate patient and family on the purpose of the ID band, the need to persistently check the ID, and to immediately notify the staff if the band comes off. Additionally, ID bands must never be placed on bed rails, wheelchairs, stretchers, walls, or charts as a method of patient identification. Patient room numbers, location must never be used as a method of identification. Barcode technology supports correct patient identification but does not replace the 8 critical elements and 8 patient rights. It is important to check with individual department for additional patient identification requirements. Reporting of an identification error and near misses is important to improve patient safety. Occurrence reports are required for missing, incorrect ID bands, and for incorrect identification and documentation. Patients with similar names are not to be placed in the same room and, if possible, placed on different units. Name alerts must be notified to the staff and patients and, if indicated, to the families. Name alerts also should be posted as per facility process. Family members with the same surname may be placed in the same room upon request. Also remember, barcoding technology does not replace the 8 critical elements and 8 patient rights. If there are any concerns, objections, or discrepancy, stop and escalate. Refer to the facility policy for identification during disaster emergencies and identification of an expired patient.
All patients within Northwell Health receive a white or clear patient identification wristband upon admission in accordance with the policy and procedure. Red wristbands, which are used to indicate patients with allergies, should include allergies to medications, food, environmental allergens, or any other substance. The fall precautions, or yellow wristband, is used to identify patients that are at risk for falls. All patients should be assessed for fall risk. Patients that have an active Do Not Resuscitate order will be identified with a purple wristband. The DNR must be ordered by either an advanced healthcare provider or physician and be active in the patient's chart. Patients with limb restrictions will receive a pink wristband. The pink band is placed on the affected extremity, indicating that this particular extremity should be avoided when blood draws or blood pressures are needed, when an IV needs to be placed, or if an injection needs to be given. If a physician or advanced care provider identifies that a patient has a critical airway, that patient will receive a blue wristband. These patients will be closely monitored for airway compromise.